Hey, I'm Dr. Malia Swanson, and today I'd like to talk to you about how can you lower your cholesterol without using a cholesterol medication. So I think about 5 key staples for women who are in menopause and are seeing that maybe their cholesterol and their sugar is spiking up, and they're wondering, what can I do to bring that down, reduce my risk of dying of heart disease or stroke without using a cholesterol reducing medication? 1 in 2 women will die of cardiovascular disease like a heart attack or stroke. That's a really high number. So I care a lot about bringing down the bad cholesterol. I look primarily at the LDL number. I'm looking to see if that's over 100. But more specifically, I'd like to look at the lipoprotein a and the apolipoprotein B to see how bad is that bad cholesterol. And if that's really high, then I definitely want to get a coronary artery calcium scan. So these are kind of the steps as I'm working up someone's cholesterol. So how do we bring that cholesterol down naturally? So the key thing, there's a couple of big keystone items. 1 huge thing is going to be muscle and just metabolic rate and movement. So muscle, as we're sitting here, it processes your sugar and fat in a great way, even when you're not using your muscle. So the more muscle you have, the less inflammation, the more you are processing sugar and fat in a great way. So if you can build muscle by lifting heavy weights, then you'll reduce your cholesterol. And how do we build muscle? So you eat protein and you lift heavy weights, which means you shouldn't be able to do more than 8 to 10 reps with that weight without breaking your form. That's how we build bone, we build muscle. Okay, what else? Fiber. You want to be getting at least 30 grams of fiber a day, preferably through leafy greens and raw vegetables. But if you can't get it all through great whole grains and leafy greens and vegetables, then consider adding in some ground flaxseed or some psyllium husk, different natural fiber options into your nutritional regimen. Okay, so we talked about fiber, we talked about muscle mass, obviously saturated fat, so pork, processed meats, red meats. My patients just love cheese and they love bacon, and these things just increase cholesterol often in a bad way. And so especially if you're someone that's already tending towards high cholesterol, you may want to look at how many egg yolks am I eating in a day? Could I shift my diet more towards poultry and fish? Fish oil is amazing, and natural oils like avocado oil and olive oil and nuts. Could I eat more of those foods and less of these heart disease provoking foods? And then refined sugar is huge. So look at your diet, see where you might be getting refined sugar in, and think about decreasing that, and that will help with the cholesterol. And then another way is supplements. So plant sterols have been shown to decrease LDL by 12% in some studies, which is awesome. Berberine can be helpful, red yeast rice, all can be really helpful with decreasing your cholesterol, making sure you're getting good cardiac exercise, 150 minutes per week of moderate exercise, really important. So these are some key ways to bring your cholesterol down naturally. And then this 5th pillar that I think is so important is menopause hormone therapy. So as estrogen goes down, cholesterol just tends to rise. And so if you had been normal your whole life and then you're 50 and boom, that cholesterol is rising, you may want to consider supplementing your estrogen and progesterone with menopause hormone therapy, which is like a low dose bioidentical hormones. They show huge cardiovascular and mortality benefit when started early, meaning less than 10 years after the last menstrual period or before the age of 60, and also really help with bone health, and then obviously treating your symptoms of perimenopause. Musculoskeletal syndrome of menopause is huge. We see huge muscle atrophy with menopause. So part of regulating cholesterol is the menopause hormone therapy to keep that muscle up, and getting in the gym and eating your protein, but it's all really tied together. And if you're talking about cholesterol in your 40s and 50s and you're not addressing perimenopause, then you're missing a piece of the puzzle that is so important. Let me know your questions, subscribe to the channel, happy to answer questions. Have a wonderful day.